You go to the doctor for a routine checkup feeling perfectly fine. Because of your age, they order a standard panel of screening tests. A week later, a minor symptomless anomaly is found. Suddenly, you are pulled into a whirlwind of biopsies, imaging, and procedures. Welcome back to Growing Young. Today, we are talking about the cascade of interventions and why sometimes the most dangerous thing an older adult can do is take a medical test they don't actually need. The medical industry operates heavily on something called the standard of care. These are blanket, one-size-fits-all protocols designed to protect doctors from liability just as much as they are designed to treat patients. But human biology isn't one-size-fits-all. As we get older, our bodies naturally develop harmless anomalies, slow-growing cells, minor cysts, or slightly elevated markers that would never actually threaten our lives or cause us any pain. Here is where the trap springs. Our routine screening, like a PSA test for prostate health or an aggressive preventative colonoscopy for someone in their late 70s or 80s, flags one of these harmless anomalies. Because of the standard of care, the doctor must investigate to avoid liability. This triggers the cascade. It leads to invasive biopsies, which carry massive risks of infection, bleeding, and immense psychological stress. Even the American Geriatric Society, through their Choosing Wisely campaign, explicitly warns against overscreening older adults. They recognize that the physical trauma of the follow-up procedures often destroys a patient's quality of life far faster than the disease ever would have. Taking control of your health means asking hard questions. Before agreeing to any routine screening, ask your doctor, if this comes back positive, what is the exact next step? Will treating this actually extend my life or just reduce the quality of it right now? Remember, you are the CEO of your own body. You have the right to look at the risks, weigh the benefits, and say no to the cascade. If you want to learn more about navigating the healthcare system and taking control of your longevity, hit the subscribe button. Stay sharp, question everything, and keep growing young.